Tomorrow is June 1st. It's the start of Men's Mental Health Awareness Month. This morning, Nick Nichols with the Vermont Department of Health joins us to talk about what the numbers show and how their Man Therapy campaign and website is helping those that are struggling.
What do the numbers tell us about how men are addressing their mental health here in the state of Vermont?
There's data that we have both nationally and here in Vermont that are very concerning regarding men and their mental health. Probably the most concerning stat is that both here in Vermont and nationally, when you look at the people who are dying by suicide, men account for about every 8 in 10 suicide deaths. And so the rate among men is 4 times higher than women. And so we know something is happening and that men are either not able to access or not asking for help when they're struggling. We also know that here in Vermont, when you look at the prevalence of people who are experiencing thoughts of suicide, it actually is, the rates are pretty similar across men and women. What we think part of the difference is that men are much less likely to ask for help. And so because of that, they're more likely to act on their thoughts and end up dying. So it really points to the need for us to be doing more to specifically focus on men's mental health, maybe reducing some of the stigma and beliefs around making it okay for men to talk about and seek help. And then also just promoting more mental health wellness tools for everyone. One of the key elements of the Man Therapy website is something called a head inspection, which is kind of like a mental health self-assessment.
Yeah.
And if you take this head inspection, there's this fictional character, Dr. Rich Mahogany, who kind of coaches you through a bunch of different questions. And he has a lot of fun. He uses humor, but it focuses on a lot of different various serious topics. And based on the head inspection, depending on how you score yourself, he gives you different suggestions in terms of tips and tools that you can use to focus on different elements of mental health. And if you demonstrated that you were really struggling, the site will also refer you to crisis services. And so even during that first 4 months, we saw over 200 people complete the head inspection just during that 4-month period, which was over a 300% increase. And so since that time, we've been promoting it statewide, and we've been happy to see that year after year, the usage and visits to the site continue to increase. Over this past year, we had almost 9,000 users visit the site. And on average, we're getting about over 500 folks filling out that mental health self-assessment. And then around 30 people a year use the site to access crisis services. So we've been really pleased, and it is an indicator to us that a lot of Vermont men are resonating with the site and finding it helpful.
Well, I just took it this morning and
Good.
yeah, and I found it helpful. If someone scores in that concerning range, what are the resources out there available to them?
Yeah, and as I mentioned before, if there's a lot of concern based on that self-assessment, the site will refer you to 988. If you don't know about 988, it's something that everyone should know. It's a national suicide crisis lifeline center, but it's actually has call centers here in Vermont. And so if you call that number from Vermont, you're going to be connected to someone in Vermont who's a mental health professional who can help you if you're in crisis. And also the great thing about 988 is it's not just for people in crisis, it's for people who are worried about someone else. And so if you have someone that you're really concerned about, or if you just want advice on like, hey, should I be concerned, or what are the mental health resources that are available, 988 is a great place to call. They can help connect you to a lot of different mental health resources and also gives you tips on things to look for.
Nick mentioned it a few times, so we will right now. You can always dial the 988 suicide crisis line if you or someone you know is in danger of harming themselves.